Good afternoon, team.
Good afternoon.
Kindly confirm you can hear me and you can see my slide. Dr.
Yes,
Jayfrida?
I can see your screen.
Okay, thank you very much for this opportunity. Though I did not hear the introduction, I want to believe Dr. Jayfrida introduced me, but maybe for the sake of those who missed, like me, my name is Gladys. I'm a palliative care nurse specialist. And today we are privileged, we are very happy to talk about cancer survivorship and life after cancer, yes, because it is not the end. We need to know how to navigate through because that is the new normal. So welcome all of you. Thank you so much for joining. And I'm going to straight away present. And sorry, I have a cold. In case you hear me cough, you will pardon me. So the outline of today's presentation, we are going to see what is survivorship. I'm going to identify and manage long-term treatments related side effects of cancer and recurrence and secondary cancers. And that is follow-up care, signs and symptoms, what the patients need to look for. And the role of the nurse, of course, by the end of it all, we'll see what are we supposed to do, and in general, the healthcare workers. So welcome so much. I cannot talk about cancer without talking about how the journey of cancer looks like. It is very complicated. And I usually imagine cancer like when you land in a new state, which you've never landed and you have no one to talk to, you have no one, you don't know where to go, and you are there in the middle of everything. So that is how I usually imagine, and this is the cancer trajectory, and of course, it is not comparable as well. So cancer journey starts at the diagnosis, and when you get a cancer diagnosis, you go several tests just to know the staging. And once you get the staging, some patients go for treatment with the intent of cure. Others go for what we call palliative treatment. And of course, most of the patients, when they go for palliative treatment, they don't understand what is that. Every patient goes through the treatment knowing that one time I'll get cure. So for those who are going for treatment with the intent of cure, some will go cancer-free and they will now be at a survival rate or remission. Others will be like managed like a chronic disease, and others will go, they will have treatment failure. Once they get treatment failure, they will go back again to palliative treatment, which will now, the intention will be not cure. And some will die. Sorry for that. Others, when you go for cancer-free, they will it's likely that they are going to get recurrence, or they can even get a second cancer, they can get a third cancer. And then the cycle goes again. If you get those symptoms again, you start again afresh, and you start at diagnosis, staging, and it goes like that. And that is all what we are talking about for survivorship. According to Susie Lay, this is a lady who had 3-time cancer survival. And she described survivorship as a process. It is a process with predictable stages, ranging from the acute diagnosis phase, treatment phase, through the post-therapy phase, and of watchful waiting. Sometimes they sit down and wait and they don't know what they are waiting for. And finally, the phase of permanent survival. Sometimes you can be told you are cancer-free and you are now surviving, you are now a warrior, you are now a victor. They call them so all manner of names. And when the focus shifts from the concerns about the risk of recurrence to those impacting long-term quality of survival, and all that is about survivorship, and that is according to Susie. Others come with different versions. According to National Coalition of Cancer Survivorship, they say survivorship is distinct phase along cancer care continuum, and according to NCCN, it is the time from the time of diagnosis through the balance of patient's life. And I like this because they value the family. When you are surviving, even the patients are also in survivorship mode, and the friends and caregivers, because their life will never be the same. You cannot tell me my husband has cancer and I am just the way I'm supposed to be. So it also affects other people in the family and in your circles. What is the content of the survivorship guide? And this one I borrowed from ESMO guidelines. And this one contains support in coping with the new reality, because it is real. This is a disease, and it is a serious disease where we need now to navigate through coping with the new reality. This is cancer. Patient could be having a denial and saying, oh no, I can't have cancer, Gladys. So who can help me? They are turning around and they are seeing darkness. They are turning around and they are saying, who can help me? Is it the doctor? Is it the oncologist? Is it my husband? Is it my wife? Life after initial treatment, how can I get my normal life back with this loss of hair, with these tingling hands, with all the side effects I am going through? And there is prevention of health. What lifestyle do I want to modify? Do I need to do exercises every day? Do I need to change my diet? Do I need all those manner of things? And then there is the follow-up care when the treatment is over. Detection and management of treatment-related symptoms. Patient might have gone through a craniotomy, an amputation, a mastectomy, chemotherapy, and they don't know how frequent do I need to go to see the doctor. Prevention and detection of cancer recurrences. You've seen the trajectory. That cancer might come back. Another cancer might occur. So you need follow-up care to detect early enough so that we can capture it. And there is also prevention and early detection of new primary cancers, just as I've said. And having been diagnosed with cancer does not mean somebody cannot get another disease. Comorbidities. This patient can get hypertension, they can get diabetes. And during treatment investigation, we can even get what we call incidental diagnosis. We can even find the patient has HIV. All this is surrounding the patient. Keeping a personal health record is also a concern, and it is in the content. We need to educate the patient to keep her health records. You need to come to the clinic after 6 months. You need to plan your care. You need to go to the physiotherapy. All that is what it contains in the survivorship, if I can call it, kit. My slide is not moving. Sorry for that. So essential components of survivorship, there is a lot of education which we give, and I'm going to talk about that in brief. So surveillance, there's interventions, communication, research, and patient advocacy. So what do I exactly mean? When I talk about education, this patient needs to be given a lot of information. It is not just to be told you are going to start chemotherapy. I don't know for how long. I don't know how many sessions. I don't know how many breaks I'll be away. Promoting healthy living styles. I don't know what to eat. I'll go out and other patients will start telling me, don't eat this, don't eat that. I need a lot of information. Skills of living as a cancer survivor, I also need to know, will I go in home and then I lock myself inside because this is too stigma, this is too heavy on me. And then we need to tell the patients about collaboration care. Surveillance it is required for cancer spread. If you feel like this, you need to come to the clinic. Recurrence, and I've said about the second cancer. Then interventions required to treat cancer and other related treatment side effects, and also the comorbidities. A lot of communication is needed, and communication skills is very important. We need to do a lot of research. What is working and what is not working? We need to understand. In prevention, where are we getting people who are coming so late to the hospital? We need to check. Are we not doing enough in prevention? Treatment in advance, are they working? We need also to know, why is this chemotherapy giving a lot of side effects and not the others? So research is needed. We need to do a lot of clinical audits just to compare what we are doing. Is it in line with the standards, international standards, that is? And we need also to test other drugs through clinical trials. And patient advocacy is very important. And I like what Kenco does and the other organizations, because we need to protect our patients, and especially those who are going to be laid off because of disease. They are going to be laid off from their work, insurance, and disability. So post-treatment effects, most of them are mixed feelings. Patients they don't know how they are feeling. They are just having mixed feelings. Fear of recurrence, there is returning to normal life. I don't know how I'm going to return back to normal after this intensive treatment of chemotherapy or radiotherapy. There is family, how to interact with my family, work, social life, sexual life, social support. And then insurance, who is going to pay for me? Dealing with feelings, the way I'm feeling, and also dating. I don't know how to go back to for the young people, this is a very big concern, because maybe this person is young, 24, 25 years, you have just been told you have leukemia, you have a girlfriend, and it is a matter of all mixed feelings. Possible physical, psychological effects of treatment. There's a lot of fatigue associated with cancer and the treatment. Now, there is what we call chemo brain. You get a lot of loss of memory, weight changes. Some people gain a lot of weight, some people thin so much. Menopausal symptoms and feelings of fears and anxiety all through your fearing. You check for physical causes and medications. Take plenty of fluids. That is now when you are managing fatigue, because that is one of the most common symptoms in cancer. You do a lot of exercise, relaxation, imagery exercises. You keep a journal of how you are feeling today. You put a book, a record, and then you can do music. You teach the patient what they are supposed to do according to their capability. Weight changes, I've said some will gain weight, others will lose weight, and they are going to be cachectic. Some women gain a lot of weight after breast cancer. I've seen them due to hormonal changes. This increases eating due to anxiety. Some people eat a lot when they are stressed or when they are anxious. Others, they don't eat. So there is weight management should be a priority for all cancer patients. Weight loss for the obese to maintain health lifestyle. The chemo brain I've just talked about, studies have shown that 1 out of 4 patients report memory alteration after chemotherapy. Patients may require psychosocial assessment and care. Help them to break information in simple language. Don't tell them a lot of information because they might not remember. And you tell them to keep reminders and manage their stress levels. Cognitive dysfunction is very common, just to repeat what I've said, and especially in intrathecal chemotherapy, neurosurgical procedures, brain irritation due to radiotherapy. So you have to take care of that as they go through the treatment, and mention to them, because they always think this is another cancer which is coming. So if you don't prepare them for that, they might interpret it in another way. Sexual life after cancer is another very big issue. 81% of breast cancer patients are never asked about their sexual life during treatment. These are studies done. Gynecological cancers, there is a lot of impact in gynecological cancers. Ovarian cancer survivors, more than 50% are impacted negatively sexually. Cervical and endometrial cancer, that 1 to 88% report sexual problems, especially if they had radiation. And the worst of all is prostate cancer. 50% of men report erectile dysfunction. So you need to take care of that because you treat the patient in a holistic manner. And if you are not asking them about their sexual life, you are leaving one part of their life halfway. So enhance sexuality, encourage the patient to keep an open mind about how they feel. Just give them an opportunity to talk about it. Self-stimulation, you teach them how to do it. They can use vibrators. Most people enjoy being touched. If it's a couple, you are sitting with them, you can just teach them how to touch one another or how to caress one another. Be patient with themselves. Let them be patient because sometimes they are imagining when they were young or when they were healthy, and now they are feeling so much traumatized now that they cannot perform. Communicate any discomfort. Let them have an area where they can come and say, I am having this, and when I come back to the clinic, I'm able to tell my doctor that it is very painful to have sexual intercourse with my husband. How to deal with erectile dysfunction. Some people benefit from medication, but let it come from a doctor. Some people take Viagra, like I've seen in urology clinic where the doctors give them Viagra, but it has to be regulated by the doctor because you know the impact in their cardiovascular. Psychotherapy is very important in this population, and especially couple counseling. So you have to tell the patient to come with a spouse so that you can sit together. If you don't do that, they go home and they feel like, now this man is going out. I am not feeling him anymore. So you have to address that. Others will feel hot flashes after treatment. So you give them you encourage them to take a lot of water, rehydration, low dose antidepressants have proved to work. It stabilizes their mood, sleep, and fatigue. Then you encourage them to do a lot of exercise, meditation, diets, and encourage them to avoid caffeine. Cancer anxiety is very normal, and acknowledge your feelings. Let them acknowledge that they are anxious because it is real, they are anxious. The anniversary dates are a reminder. Every time it is 15th August, that is the day I was diagnosed. It gives them a lot of anxiety. Have a plan for your treatment and follow-up care. Let them take responsibility of their care, of their follow-up. Share your fears with a close friend if that is possible. And if it is not possible with a friend, let them come to the professionals. Report physical symptoms to your healthcare worker, and if need be, mental health. Some useful innovations which have worked in other areas, like in the developed countries, have a cancer survivorship center. I'm happy we are being coordinated here by the MOH. So this is something to borrow a leaf. Have a cancer survivorship center. That is a survivorship center to be performed in a specific location outside oncology department. Because this patient is coming after 10 years of survival, and they are coming for follow-up care, and they are looking people who are diagnosed last week who are crying. It reminds them. But when they go to a certain place, a separate place where it is just a survivorship center, there is no that reminders. So that is something which we can think of as a country. Include all healthcare workers in that center, including oncologists, psychologists, nutritionists, social work, experts in preservative of fertility, general practitioners, navigators, and palliative care. As I wind up, there are always 7 Ds the cancer patients will always be fearing. And these Ds are, according to Jimmy Holland, the founder of International Psycho-Oncology, he said, patients with cancer fear discomfort. They fear dependency. They fear disfigurement of the body. How do I look when I'm going to be removed one breast? They fear disability. They fear disruption of life. Will I continue working? They fear disengagement, and they fear, lastly, death. So the role of clinical navigator or the nurse in the reduction of patient distress during survivorship, we need to collect all the psychosocial issues, all the financial issues, and if you can see on my left, you can see that is a thermometer. This, we call it a distress thermometer, and it is a very high distress thermometer. So you have to walk to the patient to ensure the distress thermometer level is low. So you have to ensure the patient is registering with the SHA, side effects are treated, treatment is going on well, exhaustion of everything, and the patient is comfortable. So that is what we can do to support the patient. And if the patient finishes treatment, we enroll them back to the community. Thank you. That is my short presentation. Thank you very much.
Thank you. Thank you, Gladys. Thank you for that very informative presentation. I think we've all been well guided on how we can help our patients during their treatment and even post-treatment, how we can care for them. So let's all find a way to plug in. Okay, so I think next we'll go to Eva. Eva, please introduce yourself, tell us about your journey, and tell us how far you are in your journey, and perhaps just highlight the key aspects, the things that are going right, what things are you struggling with, and how can we all assist in one way or another. Hi,
Can you hear
Eva,
me?
can you hear us?
I'm speaking.
Yes, yes.
You can hear me now?
Yes, yes, yes. I can hear
Okay,
you.
perfect. Okay, thank you. So my name is Eva Alela. I am a breast cancer survivor. I was diagnosed with triple negative breast cancer in 2020. That was the COVID year. And I'm grateful that I am here today to speak about my journey as a survivor. I'm looking forward to next week when I have my I'll have scans and I'll have my review, and just jumping into some of the things that Gladys spoke about. One of the burdens that survivors live with is anxiety. There's something that we call scan anxiety from scans. This happens during the period when somebody gets scans. So I'm anxious about the results. Will I be clear? Will I get another ticket to continue enjoying my life for the next couple of months until my next review? So, and especially for triple negative breast cancer, the 5-year mark is quite significant. Not that I'm totally out of the woods, but it means that the risk of recurrence has been significantly lowered. So I'm really, really looking forward to, getting this clearance. But at this moment, I am sitting here with anxiety. So that is one of the things that we live with in survivorship, especially, we have to have a scan sometimes every 6 months. So every 6 months, there's this 1 week where, you have fear, you have uncertainty. So the emotional burden is huge. Especially during this time. So apart from the emotional burden, and how I choose to deal with this is I accept and I acknowledge that this is heavy on me. And most of the times, apart from now the emotional burden that comes with the scans and the fear of recurrence, it's just to accept, we are grieving the person I'm grieving the person that I was before this diagnosis. I have lost a little bit of the person I was. I'm not as physically strong and as active as I was. I try as much to do my best. However, you know, I grieve that person, but I've accepted this new person that I am, because accepting is part of healing, and it's part of the journey towards now just learning to live with this new normal that comes after a cancer diagnosis. Another struggle that comes with survivorship is, you know, the long-term side effects of the treatment. So physical recovery is not something that happens, you know, once the treatment is over. Before this, I thought that, okay, once treatment is over, I'll just jump right back into my life, as it were. But this has never been the case. And the one thing we've always understood as survivors when we speak within our spaces is that it takes time and it takes patience, and it's different for everybody. We don't go through like the same side effects. Somebody may have struggled with chemo, another one didn't, another one struggled with radio. And then depending on the treatment that we went through, there are patients who, for example, in my case of breast cancer, those who had either a single mastectomy or a double mastectomy, the recovery is different. So we learn to talk to each other and to comfort one another depending on where we are in the survivorship space. We are always sharing tips on how to improve, how to deal with the side effects. You know, I'm having brain fog, what can I do? Somebody says, you know, you can try you know, include this in your diet, take a little bit of maybe omega-3 supplements, you know, to help boost your brain. Neuropathy, this is what I did. So a very, very important aspect of survivorship is having a community where you can always run back to and share your experience, because there's always somebody somewhere who went through what you're going through, and they may learn a thing from you. So we don't have to, you know, to suffer in silence and suffer quietly. So I think the community is a very, very, very important aspect of dealing with survivorship. Another thing, I encourage that we listen to our body and don't compare our journey to others, because I may say I went through this and someone is like, I didn't go through that. Then one day, you know, somebody goes through the same thing. So we all have a different journey. It's not the same. I believe even if there are any doctors on this call, you know that every patient is different. They come with they handle the illness differently. They handle the treatment differently. You know, sometimes I know in my space, there are times when someone says, how come I was not given that drug? You know, how come this wasn't done for me? And we always say, just go back to your doctor, because there are many things that the doctor looks at when they give you a treatment plan. So it's not, it could be depending on your age, it could be depending on the staging, if there's any, you know, lymph node involvement, or there are many things that determine treatment. So sometimes there are patients who feel like I was undertreated because you got these tablets, I didn't get these tablets. So we do not compare our journey to others, but we listen to one another and encourage one another to, most of the time, just go back to your doctor and find out why you are treated this way instead of that. And the very, very important thing is to have regular check-ins, even years after treatment. Well, sorry, for me, like after when I started the treatment, my check-ins, when I finished treatment, my check-ins were first every month, then it moved to every 3 months, and now it's every 6 months. I know there are patients who I think have reviews every year. So we are encouraged to continue being in touch with your healthcare team, and whenever I feel anything, or we feel anything that is not normal, always run to our doctors. I say this because when I was going through chemo, at some point, I think during the third cycle, I think the fourth or the fifth cycle, I started getting very, very tired and going out of breath. You know, I would have brushed it off and said, it's the chemo that is exhausting me. I'm tired because of chemo. I'm tired because of the cancer treatment. I'm tired because of the cancer. So when I went to see my doctor and I mentioned that I'm going out of breath and I'm getting so tired when I do the smallest of things. So the first thing my doctor told me was, you might have blood clots in your lungs, When I was sent for a scan, it was actually found that I indeed had blood clots in my lungs, of course, as a result of the chemo and maybe the cancer itself, and that I was put on immediate blood thinning.
Hi, Eva. Did we lose you? Eva? Okay, let's give Eva a minute. Eva, are you back?
I've changed my. Can you hear me now?
Yes, 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 we can.
Okay, I think it was the problem with my headset. Okay. At what point did you lose me? What was the last thing you
You
had?
were telling us about the blood clotting, the blood thinners you were put on.
Yes, yes. So I think the why I like sharing this story is that because we may sometimes imagine that it is normal to feel some things during cancer treatment, but I don't think anything that you didn't feel yesterday that you're feeling today is not normal. So encourage survivors to really, really listen to their bodies and always ask their doctors or tell their doctors when they feel anything different. So this is just to have a very, very close relationship with our healthcare team and always walk this journey with them. The other thing that I think I will jump on, which Gladys also spoke about, was in terms of relationships. I think cancer weighs a lot on the patient and the people around them. In some cases, it may strengthen some relationships, especially with those who come close and work with you, your caregivers who are with you every step of the way. It really strengthens this relationship. But then we also have these other people who sometimes don't know how to deal with you, and the relationships fade and they sort of distance themselves. And then there is this thing of somebody feels that you've been going on for this too long. You should be okay already, especially when treatment ends. It is always assumed that, treatment is over, everything is over, now you're coming back to normal life, not knowing that the end of treatment is the beginning of another difficult journey, because now we are dealing with the long-term side effects, which we did not know about. So I think what I encourage here is that we learn how to communicate our feelings, whether how we're feeling physically, how we're feeling emotionally. And another thing that affects people a lot is the image, especially with the loss of a body part that is associated with intimacy. This really calls for close communication and sometimes even involvement of partners in the case where a woman, for example, loses one or two of the breasts. This will need the partner to be very, very understanding. I know that just because I lost my breast, I'm still this person that you love. I'm still this person that we agreed or we promised to do life with. So it does have its toll on relationships. So the other thing is, which sort of affected me, was in terms of my career. I did lose my job. I don't know if it was in relation to the cancer treatment or what, but when I finished treatment, I lost my job. And of course, that was an additional burden because, I've just been going through this illness and now I've finished my treatment. I'm ready to jump back into work. And then it's, suddenly I don't have this anymore. Well, I was fortunate to be able to get back into the workforce, and I encourage that we are open, especially with colleagues and people we work closely with, because sometimes from nowhere you get fatigue, you get memory issues, brain fog, as Gladys mentioned. So we really have to be open and clear with the people we work with. Like usually, I tell my colleagues when they mention something to me, I tell them,
I highly likely will forget this. So drop me a text or send me a WhatsApp tomorrow at 9 a.m. so that I can action this. So communicating openly and freely with the people that you work with really, really helps them to understand that so that I don't prioritize. I just have this thing that kind of interferes with my memory at one time or the other. And then finding a purpose. I think for me, speaking here is one of the purpose that I found beyond the cancer. And I started speaking about my journey and my story because when I was diagnosed, it was during COVID, so there was not a lot of moving around, and I went online, trying to look for anybody who is going through that. I can read their story, and there was not much going on social media back then. And I thought, let me be that person who is talking so that if anybody is diagnosed after me, they go to Facebook and they'll find this person who is talking about their experience and they maybe learn a thing or two. So this is now how I started, my advocacy and teaching about breast health, reminding, women and everybody to do their monthly breast self-examinations. So this is fulfilling for me as it is healing, because in speaking and sharing my story, I find healing, because for me, it means that I moved from that place where first, I was in denial. The first weeks of diagnosis, I kept on wishing that I'd get a call from the hospital telling me, oh, you know what, there was a problem with your sample. You actually don't have cancer, but well, that was not to be. So for me, that is where I found my purpose in mentoring people who are newly diagnosed, in advocating, and in just just being that voice for breast cancer survivors. And I think lastly, the things that I would say help me to thrive. I follow many survivors on social media who are thriving and doing amazing things. And so when I started my social media advocacy, I was, riding on the shoulders of many survivors and advocates, especially from the United States, who, they speak, they share their journey, they'll show that this is what the mastectomy looks like, this is what the reconstruction looks like, this is what this side effect looks like, this is what lymphedema looks like, this is what I'm doing about it. So finding people who are living positively is very, very encouraging, because it gives us hope. Whilst cancer many a times causes end of life, there are also many positive stories where people have thrive and they live on. We always look on the brighter side. We are not in not to stay in denial and not to bury our heads in the sand, but just to focus on the positives that can help us live each day with purpose, and just to make things better for ourselves and for the people around us. I know that people who say journaling helps them. Write down your feelings, the days when you're feeling low, the days when you're feeling high, the days when you're feeling good, just to track your feelings and your emotions. You might even find that you'll discover that you have triggers. Like you'll discover, I feel low on this day of every month. Then you're like, oh, this is the date I was diagnosed. And then learn how to find a way to distract yourself on that particular day so that you don't sink into that sad place. One very amazing tool that helped me, when I was just roaming around social media looking for anything, I found an organization called A Fresh Chapter. With A Fresh Chapter, I did a 10-week program called Ignite. And this helped, it introduces tools that helps one to navigate through life after cancer, learning how to accept your emotions, learning how to sit with them and to acknowledge them, learning how to hold space for yourself, to hold space for other people, to listen to them, how to communicate with other people. It even helps how to tell your story and how to advocate for yourself and for others. So this has been something that was very, very, very helpful to me, in addition to many support groups that have joined. It's a good place, to find that you are not alone, And there's a lot of encouragement going on. We share tips about even diet, you know, and both the myths and what is true, because I know in the survivorship, there's so many myths. Today, there'll be this fruit that kills cancer cells, and we'll all go running towards that fruit. Next week, there's a new juice that we need to drink. The other week, there's a lot of information and misinformation going on. And so this calls for us being very intentional and careful with the information that we consume and the things that we choose to practice. I think with that, I will stop so that I can allow the other speakers to share their stories. But for now, I embrace the new life that I have. I know the possibilities, what I can do, what I can't do, and always have an attitude of gratitude. Thankful that I am here today to speak, and thankful that I am where I am, to build resilience and to always be self-aware and believe in myself and what I can do for myself and what I can do for others. Life is good, and it's a joy, and it's worth celebrating no matter what the circumstances. Thank you.
Thank you. Thank you so much, Eva. We can definitely feel your positive attitude. And I think that's a really big step in just living a good life. As we always say, the quality of life of a patient during treatment and after treatment is very important. So thank you. Thank you for your courage to even share your story, and for encouraging all the other patients who are in the journey. So the theme for the Cancer Survivors Day for this 2025-2027 is United by Unique. So there are different types of cancers, and we were privileged to get different survivors who were willing to share their story. So next we are going to hear from Moses Omondi. He'll tell us when he got diagnosed with cancer and how his journey has been up to now. Moses, karibu. You can unmute yourself.
Hello. Yes. Can you hear me?
Yes, we can
Hello?
hear you. Yes, we can hear you, Moses. Continue.
Okay. My name is Moses Omondi. I'm a bone cancer survivor. I was diagnosed back and since then my life took a different turn, because when I was diagnosed with bone cancer, I went through my treatments. I went through one cycle of chemotherapy. But what really shocked me was in our family, we had never experienced such things as cancer. So when the swelling started, I just took it like a normal thing. So it started slowly on my right leg. I used to see a small swell. And then I went to my parents, and I told them that I can feel pain on my knee, but I really don't know what's happening. And then they told me like, we know you boys, you like play football, maybe you got an injury on the field, so we'll just put warm water on it and some road, and then rub it, and it'll be okay. So that's what they did on the first day, but second day, third day, a week came and passed, it started swelling. So I went back and I told my parents like, this swelling is not going down. Instead of going down, it keeps on increasing. And you know, our typical parents, they call those aromatherapists to enter, they come, someone comes and like just rubs the wound and say that the boy will be okay. Because by then, we have not heard of cancer in our family. So I went back to school. I was around from 2 third term. So I went back to school, continued like that. Every day was just, we could just put warm water and robe like that. So a month came, we closed the school. So when we came back to Form 3 now, that was around now 2014. So one day on the parade field is when we fainted. And when we fainted, they called my parents. And the head teacher now told them, my dad, like, we saw Moses, he was okay on the field, but all of a sudden, he just lost conscious and he fell. So my dad told the principal that I know he has been having this kind of problem. Let us take him to the hospital. I was taken to Neema High Hospital in Kasarani, and some X-rays were done. But when the doctor looked at the X-rays, he didn't tell my dad actually what is the problem. He just told him like, take your son to it was Kiambu Level Hospital, take him to the doctor. We read that X-ray for him, and then we will get our results. So we did that. We went to Kiambu Level Hospital, and while at Kiambu, the doctor looked at the X-rays, and then he just wrote a referral letter to Kenyatta. And now there is where our journey started, looking for bed back then in 2014. Looking for bed was a hassle. So you are being told, come on Monday, every Monday, go and come. So by the time now we are getting bed, it was around March. So from January to March is when I got a bed. And by then now the swelling had already increased. It was like the size of now my head, big. So the doctor looked at me and said that we are not actually sure what this is. It can be a tumor, but we don't know if it's cancerous. We just have to do a biopsy test to be sure. And then I was booked. I did a biopsy test, and then I was discharged again for like another month, for a whole month to wait for the results. So by the time when the results were out, it was around June, like this. And then now the doctor, when we went back, I was removed. And now the doctor looked at the graph and he called my dad in because I was still around 17 years. He called my dad and he told him that we've seen the swelling and this tumor now is cancerous and it's a bone cancer. And the state that this thing is, we just need to do the amputation first just to contain it before we do anything else. So upon hearing that, the room went outside. The rest of the information was passed to my dad. And then he told me like, you need to be admitted. The worst part is you lose your leg. And we started with them as a disabled person. So I went back. We took some time with my family. We just deliberated, talked, and tried to that will be not the should take life positive. Like they tried and really tried. But eventually now I had to accept the situation because the swelling was becoming bigger day in, day out, and it was draining my blood in the body. My body is really, really thin. But if you looked at the size of the swelling, it was big. So I had to be booked, and I went for my amputation on the 7th of July 2014 is when I was amputated. And now, from there, now I started a new journey. So after amputation, I took like 2 weeks in the hospital. And the nurse now told my dad, like, it's okay, you just have to discharge it for now. And then we will go home. And then after that, then we start now your sessions, the chemotherapy sessions, just to make sure that the cancer is gone. Because the swelling was around my knee joints, but now the amputation was done up around the hip, is when the doctor told us that it will be amputated just to make sure that it doesn't spread to the other part of the body. And then now when I went home, the 2 weeks after discharge, we had to consult because back then chemotherapy and radiotherapy, the outpatient services were not covered under the NHIS. So we are supposed to pay like 10,000 every 3 weeks for the sessions. And I sat down with my parents. My dad was like, it was Wakali, didn't have a stable job. My mom was a housewife. So we just had to sit down. And when I was in the hospital for months, when the biopsy was done, and then the discharge, and then I went back and I was readmitted, I saw the kind of challenges they went through. Sometimes my dad would come. He walked from Kariobangi to Kenyatta Hospital just to save the 200 shillings so that he can buy bread and milk for me. We didn't have like a lot of money. And so when I saw this struggle that we went through, and when we sat down, and we'll have to come up with a way to get this 10,000 shillings. after 3 weeks. What do you think? And then so the first session I went, I told him, doc, just tell me the truth. You have finances on this thing. The amputation, was it all that you require to do, or you need to do the other side, or it's done, or the amputation was successful? When it was removed, all the cancer went through. And the doctor told me that looking at where the cancer was and where we amputated you, that was like the main procedure. So these sessions are just to make sure that it doesn't spread to the rest of the body. So that I went through was the main thing. So these chemotherapy sessions are just to make sure that it doesn't spread on the body. And I told them I believe in God. So from here today and now, let's leave it in God's hands. And after the first session, I went home and said that I'm tired. I was drained. I was tired about cancer, hearing about cancer. I saw what it did to my dad and my mom. Even after finishing, after the discharge and the first session, they had lost everything. And then now they relocated back to the rural area. So they told me that we are going to do farming and everything. So the little money that we'll be getting farming is what we'll be sending so that you can go for your session. So that really broke me down. And I just gave up and told my dad, like, no, let's leave it in God's hands. I just went for the first session. That was to make sure that it doesn't spread to the rest of the body. Let's give it time. If it's spread to the other parts of the body, we'll go back to the hospital. If it's not, well and good. And that's how I started living my life. It's been over 10 years from 2014. So come 7th of July next month, I'll be celebrating my 11th year of being cancer free. But the new person, I've worked on images and now. So in terms of family, they really accepted me. They gave me the support was still in the age. And so after 2014, 2015, I went back to school. Instead of going back to Form 3, I went back to Form 4. Yeah, my classmates really helped me. They encouraged me. They were there with me. But life has ability. I was afraid to go, but a month or two without going out. With a bit, and I had a child saying, "Oh no, you can't do like look at this grandfather. He doesn't have a grand in the house." And I told my dad and my mom that I feel low, I feel bad. And then my mom sat down with me and she told me like, Moses, this your new life. You like your new life story. And that, yeah, I've been strong ever since. So thank you so much for this opportunity that has been the time, and let me allow someone else to share the story. If there is any question, we're still on call. Thank you.
Thank you. Thank you so much, Moses. That was very brave of you to give us your story and the different dynamics, given that you were a child when you got the diagnosis, and just how your parents really had to support you. And yes, we are very proud of you for handling that and up to now. So I think we'll come back to you if you have any questions. I know you currently work with prosthesis, so I think that's also something you'll tell us later on how it's going. Next, let's hear from Timothy Gitau Ngugi. I think, Timothy, you had mentioned you got colorectal cancer twice, or if I'm not wrong. So, Timothy, please introduce yourself and just tell us how your journey started. Thank you.
Yeah, thank you. I hope you can hear me. My name is Timothy Gitau, and indeed, as you have said, first let me introduce myself as Timothy Gitau, a husband, a father, a son, a friend, and a colleague. I like to introduce myself most first before saying I'm a colon cancer survivor, because I don't want to believe that colon cancer is what defines me. I am more than that. Indeed, as you have said, I have had cancer twice in my life. The first time I got diagnosed was in 2014. I had some symptoms, colon cancer. We get bloating, some back pains, and also blood in the stool. And this prompted me to go and get some treatment. After several treatment of stomach upset with no relief. After that, we did a colonoscopy. Since there was a history in my family of colon cancer, my father also had colon cancer, and unfortunately, he lost his life as a result of it. So that being at the back of my mind, I really had to go and have myself checked. And indeed, they did find that I had colon cancer at that point. So the course of treatment that I went through is that they did a resection of the colon, and I did cycles of chemotherapy, which was a combination of IV chemotherapy and oral chemotherapy. In 2015, I was checked and I was told I was cancer-free and started living my life. Unfortunately, again in 2019, the symptoms were back. And again, I went for testing, and I was found that indeed the cancer was back. As I've mentioned, there was a strong family history of colon cancer, and the fact that there was a little, the part of the colon that was remaining was small. The doctors made a decision in 2020 to remove, to do what they call a proctocolectomy. This involved removing the whole of my colon and also the rectum. As a result of this, I was fashioned with an ileostomy, where my waist goes through, and I have to use a colostomy bag, which I use until today. Following my fashioning of a stoma, I joined the stoma organization, where I get a lot of support in terms of sourcing for bags and also for group therapy. I would say that I've had a lot of support from my family, my friends, and also my colleagues in this journey. However, there are many challenges that come with the life after treatment. One of them being the use of stoma bags and others. Now, unfortunately, the danger of coming last is that most of what you had prepared to talk about has already been mentioned by people.
Hello, Timothy. Are you speaking? We can't hear you. Timothy. Okay, let's give Timothy a minute to rejoin.
Can you hear me?
Yes, yes, we can hear you.
Oh, sorry. Unfortunately, the lights have gone off where I am, so my Wi-Fi cut off. But let me continue. As I was saying, the unfortunate thing of being last is that many people have said what you wanted to say, but I'll just say a few things. First is to say that, as Eva has said, this journey is very unique to everyone. No people go through it the same way. So it's a journey that is unique, although we share, and it helps to share. Like Eva, I've wanted to always share. I don't like owning the disease, and since my diagnosis, I've been open about it, and I find that it helps me to deal and cope with the effects when I am able to share with other people. In my view, cancer survivorship and the new normal involves adapting to life after treatment, which includes three aspects. There is the physical aspects, there are the emotional aspects, and there is also the social aspects. In the physical challenges aspects, as mentioned before by Gladys and Eva, and also by Moses, there is one about the lingering side effects from treatment. The issues of fatigue, always feeling tired, these are things that I have experienced and I continue to experience those many years after treatment. The issue of neuropathy, pain, and also the issue of chemobrain. Chemobrain is something that really disturbs cancer survivors. I always have some battles with my wife when we meet somebody and she'll ask me, unakumbuka huyu ni nani? And I can see the person and I'm trying to bring it out, but many times you cannot be able to tell who this is. So chemobrain is one of the things that really is an effect. Somebody needs to deal with it afterwards. The other thing is secondary health risks, things like hypertension that come about as a result of the treatment that you have gone through, weakness of the bones, because of what you have gone through. The other things in physical challenge that I'll talk about is the body image changes. Like for me, now I have a stoma, which is my body. I didn't have it before. I have to learn how to live with it and accept it. That's one of the biggest challenge that people have as cancer survivors. Once they have scars, weight issues, just like Gladys talked about, stoma like myself, amputation like Moses, people who get mastectomy, you have body changes issues to accept that now your body is different. And this one extends to even intimacy issues. In my organization, Stoma World, we've had stories when we talk to people and where their relationships have ended as a result of their partners not wanting to understand that this person is now different. They are living with a stoma, they are living with a bag. The bag comes with other changes like leaks. Sometimes it falls off. Sometimes there are orders that comes from the bag. These are things that we have to adapt and also recognize that they affect our daily life. The other aspect I'll talk about is emotional and mental. First and foremost, the thing that stays with us the most is the fear of recurrence. Once you be diagnosed with cancer, you're always afraid and you have done treatment, and we all know, those who have gone through it, and I'm sure many of you are medical practitioners, know how rigorous the treatment for cancer is. And once you've gone, it is not something that somebody wants to go through ever again. So we are always afraid, and it's always at the back of our mind that it can come back. For me, it did. It did come back. And even today, I still live with the fear that it may come back a third time. So this is something that is always at the back of our mind, that the cancer might come back. This then brings in the issue of anxiety and depression. You're always anxious. As Eva said, when you're going for these tests, you're always anxious. What will I get? What will I get? These are issues that cancer survivors go through every time and must learn how to adjust and live with them. The third aspect I'll talk about is the issue of social adjustments and also work-related adjustments. About family, as I mentioned, there are shifts in relationships. The issue of bisexuality, where maybe for men there's an issue of erectile dysfunction as a result of the cancer and the treatment that comes in, especially people who have gone through radiotherapy. For colon cancer, there is that issue that crops up. This also shifts now the dynamics in the home. There is also issues that when it comes with fatigue and your ability to work, you find like he's a father who has become sick and has recovered, though their ability to earn as they were before sometimes is affected. So the wife has to shift the role and become the primary bread earner if they were doing both. Vice versa, you can find that when a lady is the one who has been dealing with cancer, the man who is normally not expected to do parenting the duties as much as the lady is forced to come in. So these are adjustments that affect cancer survivors. That is a reality. In the workplace, there's the issue of fatigue and job security concern. You might not be able to work as good as you are. If you're in a place where you don't get a lot of support, that might affect you or your job security, or even you might even end up losing your job. The issues of memory loss. Some jobs require you to be very fast in your thinking and answering questions very fast. Sometimes they may not be so understanding that as a result of your treatment, some of the memory is gone. For me, I am fortunate and I'm always thankful that where I work, Morana University of Technology, I've always gotten the support and they understand the journey that I've gone through. The other thing about social and work related is about the financial burden. We all know about the cost of treatment. The cost of cancer treatment is very high. This leads people to end up with debts, a lot of debts. And even post-treatment, there are these checkups that you have to go through for the rest of your life, basically. And these come with costs related, insurance related, which are costly. That is also something, a new normal. The tests and the checkups are a new normal that you have to deal with. There is also issues to come with lifestyle changes, health and diet. Like for me, there are things that I cannot eat. For example, I'm advised to just reduce on issues on foods that are high on roughage. This is something I didn't know, but you have to adjust as life coming, have new diet sometimes, sleep hygiene. As a person living with an ileostomy, we all know ileostomy, the output is quite a lot. And we end up emptying a lot. At night, I have to wake up sometimes several times. This interrupts your sleep schedule and also adds to the fatigue. This can cause a lot of stress to person. And one way of dealing with it is going for counseling, also trying meditation and things like yoga. In the new normal, as we call it, there is need for a lot of support and resources from peer groups, like, for example, now Stonewall Kenya offers those peer group support, where you can go and sit and discuss with people. When I was first told that I would have a stoma put into me, I had no idea what it is. I had never heard of it before. And so it was quite disturbing. So when survivors find themselves in this situation, it helps when they talk to others who have been in their position. As much as we say the journey is unique, there are also very many things that are similar, people who have gone through similar or even worse, and it helps to discuss with them. Counseling and mental health support. I am happy that now around the country, there's a lot of talk about mental health and mental health support. And especially for men, because we have a problem in sharing and we absorb a lot of issues without talking. So mental health is one key support that cancer survivors need to help them live in their new journey. So many of the things have been mentioned, and I would like to conclude by saying that after treatment of cancer, in the journey of survivorship, it is a journey. It is not a destination. It's a journey that we go through, a journey that we need a lot of support and a lot of resources. I like what Gladys talked about, having a center, a survivorship center, where survivors can go and share ideas and talk about that. In the new normal as survivors, we are called to accept where we are at and what we have gone through, adapt to the changes that we are having, and finally have grown. This calls for managing our health, addressing emotional needs, and finding meaning, purpose in our life. So there is life, as we always say. Cancer is not always a death sentence. And even after the treatment, there is life after that, as long as we accept, adapt, and are ready for growth. So I'll end here because many of the things have been mentioned by my speakers before. And thank you very much for having me. We
Sorry, Timothy, you were breaking for a few seconds there. Okay, thank you, Timothy. I think he'll be joining back in a minute. But thank you so much to our three speakers of the day who have given us their lived experiences. We really appreciate the great insights that you've given us. And so we'll go through the questions. And I think most of them actually comments. There's a few questions, but I think I really loved these comments whereby one attendee has said that the personal experience by cancer survivors is very encouraging. It restores hope in many patients, and so that's actually the great highlight of this session. That is good to hear from the other side. The health, as healthcare workers, the service we offer to our patients, what is the experience? What is it that they really need us to do? So thank you so much for the three speakers of today. Someone is saying, thank you, Gladys, for the presentation. And regarding survivorship, you mentioned that the clinical center should be separate from the oncology unit to prevent survivors from reliving difficult memories. She's asking, there's also the value in newly diagnosed patients witnessing survivors who have successfully navigated the journey. It could provide them with hope and reassurance. What are your thoughts on this approach? So maybe Gladys, give us this approach. Do we have survivors who come now to navigate new patients and offer them support? Gladys?
Yes, Dr. Joyfrida. Thank you for that question. And yes, it is a concern when we are talking about separating the survivors with the newly diagnosed. However, we have those who are still in the progress of treatment. Maybe somebody is finishing, maybe somebody is starting. And this approach is not everyone who who will be enrolled to go for that clinic, because this is a good approach in the Western world, because in Kenya, in our African setting, majority of patients, once they finish treatment, they don't want to hear about that clinic again. And that is why we get lost to follow-up care, and they go because they don't want to remember Kenyatta again. They hear of Cancer Treatment Center, Kenyatta Hospital, and it reminds them about bad experience. As Timothy has said, no one want to remember what you have gone through chemotherapy. So they go, they don't want to do a follow-up care because they just don't want to visit that place again. So it would be a good idea to have that clinic aside. And we have support groups where us as palliative care team, navigators, oncology nurses, we are able to identify the newly diagnosed and put them in support groups. They work very well, especially where I work, because if you have been diagnosed with cancer, we give you a peer mentor and we put you in a support group in that line. Thank you.
Thank you, Gladys. So the next question is a question about nurses being trained on breast specialized care, and they offer breast screening, early detection for breast cancer to the population. Is there training in Kenya for the same, as it's the most common cancer among women? Gladys, do you have insights in that? Although I can also answer on another angle.
I think that this one is majorly aiming at you, but what we have in Kenya is just oncology nurses training and palliative nurses. And in those trainings, we usually get modules on how to do screening of breast cancer. But yes, Dr. You can respond to that as well.
All right, yeah, thank you. I think that's good what you've said. The oncology nurses training, I think you are offered that. And from time to time, we've been doing, as a ministry, we've been doing capacity building of nurses across the country. And we leverage on both cervical cancer screening and breast screening, because the woman is one. So, and we really encourage the integration of both services. So if you're a nurse at the family planning clinic, as you are advising this patient on the family planning to put, maybe even you want to insert an IUD, kindly advise the patient also on doing a cervical cancer screening. And while at that, also check their breasts. You can do it for them. A clinical breast exam is very quick, and you don't even need any equipment for that. And you can even show the patient what to do at home. They can also do the self-breast exam. So as healthcare workers, we are integrating these cancer screening services at all service points, even in the CCC, in the outpatient clinic, when a woman comes, even with just a headache, or they're coming with, I don't know, ulcers or some bleeding, please just ask them if they've had their checkup, because this is something that needs to be done as frequently as possible, if possible, at least even just once a year. So yeah, it's something that is ongoing. So thank you. Another question is about palliative care. So Dr. Mwinga would like to know from our speakers, was palliative care offered to you during your journey of care? And I think we'll start with Eva. And yes, Eva, maybe tell us, did you receive any palliative care support during your treatment?
Not that I can think of. I think everything was being handled as it comes. So it was not like, standing on its own that this is now palliative care. We were managing every need as it came by. Maybe we could hear from Moses and Timothy about the experience.
Okay. Timothy?
For me also, I did not receive any. So as Eva says, dealing with what comes.
But did you receive, I don't know, any form of counseling before treatment or during treatment or after treatment?
Absolutely, yes. I think for me, counseling was every time I went for chemo, after the appointment with the doctor, when the chemo was running, then one of the nurses would always come and we'd have a little chat with them, just checking on me, on my state of mind, on how I'm feeling physically. Yes, I would say that that sort of care I did receive.
For me, unfortunately, I did not receive. I did not receive the counseling. I would, if, for example, when I go for chemo, I'll just go into chemo and off I go home.
So there was no counseling. Moses?
Hello, am I audible enough now?
Yes.
Okay, for me, also I didn't receive during before and during treatments. The only support I received was from my parents, who told me to be strong and like that. Because also I had reached a point where now it was like my breaking point. I was so tired of the sweating. The leg was heavy. It was big. So, but after treatment, like a year or something, is when I was introduced to palliative. To Nairobi hospitals, where they offer palliative care, and we used to meet on mostly on Thursdays. They could give us some food stuff just to support us to just continue with life. Yeah, so during treatment, no, but after. Now, during when I was looking for support groups, is when I was introduced to my.
Okay, all right, thank you. So I think there's a big gap there in terms of psychological support and palliative care in general. There's even a question about there being a large number of people who have done palliative care, yet they're not nurses, and how can they put on board? So I think, yes, the palliative care is not just for nurses. Anyone can actually undertake the course, and this just helps you just to manage the patient that you're handling. And palliative care is not specific for cancer patients only. It goes beyond any patient with a terminal disease or a traumatic injury. They require palliative care just to ensure that they're living a quality life. So another question is about disclosing the diagnosis of cancer to a child, and who should be involved in the process, at what point or age does the caregiver do this? Gladys, what have you seen in your experience?
Yeah, thank you for that question. Yes, this is one of the challenging areas in counseling a child, and especially disclosing diagnosis. So one, it will depend with their age. It will also depend with their developmental stage, because you could be 10 years, but you are not able to coordinate, or you're not able to comprehend what we are talking about. And yes, there is a child who is 5 years, and when you are going to visit them, and you visit the mother and you are talking there and you are looking like, why are you discussing me? Mami, what are you saying with the daktari? They want to know. So it will depend with their developmental stage of their life and their understanding, and are they ready to get the information. Otherwise, the way we will break the news to the mother is not the way you break the news to the child. The child can only understand very small junk. So you can tell the child something small today, then you come tomorrow and break another, you give another information like that. And yes, we have so many, and they really want to know, because they think like we are just talking to the mother, and they are left aside, and they can be annoyed, and it is a source of anxiety to them.
Okay, all right. The next question is there standardized steps to follow, like in cases where, say, a mass has been confirmed, is there a way to go to the definitive test instead of guessing which other tests that are known to have a big margin of error or false results. I think this I will take. From the ministry, we have the national treatment guidelines that actually outline the different stages. And the specialized staff in these cancer centers, they actually know how to do this. They know when a mass is found, the next steps. There's a whole chain of events that a patient is taken through. So that will help them to, because there are various pathways. It's not just one type of breast cancer. It could be different types of breast cancers, or even if it's a mass, it could be there could be different things. So there's a whole chain on how to do the definitive tests. Okay, so as we wind up, there was a question about the hereditary connection with cancer, and I think both Eva and Timothy have an experience on this. So maybe Eva, you can tell us your view on this. Do you have a family history, and how did you manage it? Thank you.
Okay, so by the time I was, investigating the cancer after I found a lump on my breast, I already knew that I had close relatives who had cancer. First, my grandmother, my paternal grandmother, who passed on in the 1940s. They say she was killed by a disease of the breast. And then the next family member was my father, who had liver cancer. He passed on in 2001. Then this was followed by my paternal cousin. This is a daughter of my uncle from my dad's side. She got breast cancer. And then my uncle, my paternal uncle, my father's brother, was also diagnosed with breast cancer. Then I was the next. So by the time I was, I gave the doctor this family history. So when I was sent now for the biopsy and the type of cancer was confirmed, she said she suspected that it would be triple negative breast cancer, because especially if you have a male relative who has had breast cancer, it is highly likely that what I have would have been triple negative breast cancer. So what the advice I was given was, for one, my sisters to now be more keen on their breast screenings. Like if I have a sister who is over 40, she must go for her annual mammograms. And the sister under 40, because of course mammograms are not done under the age of 40, she needed to have either an ultrasound or an MRI just to see if there's anything going on in her breasts. Then, well, unfortunately, while I was just finishing my treatment, another cousin, still from my father's side, was diagnosed with breast cancer. So from my father's side, we have had 3 cases of breast cancer from ladies, one from a man, and then liver from my father, and then another cousin who had throat cancer. So I know the whole family, entire extended family, live in fear. But what we now advise is, number one, just try to have a lifestyle that lowers the risks, which we are all aware of. And then secondly, to be keen on our screenings for the male relatives, just go for prostate screening as soon as you reach the age that it is recommended. For the ladies, we have to be very, very keen on our monthly breast self examinations. Yeah, generally that is the advice that I was given. And then I was sent for a genetic test, which I think with that strong history, it came out positive. So I was found to carry the breast cancer 1 mutation. It's called BRCA1. So this for me means that I stand a high chance of recurrence of breast cancer, and also I stand a high chance of getting ovarian cancer. So for me, this means that to continue being keen on my screening, both for my breasts and also for to get abdominal ultrasounds, just to check on my ovaries. in the West, and I think here as well, there are instances where if a woman has reached the age where, you know, she no longer is interested in childbearing, they would remove the ovaries just to lower the risk of this cancer coming to the ovaries. And also they highly recommend mastectomy for women who have found to carry that that breast cancer mutation. So for now, it is just trying to have a healthy lifestyle to lower the risks and to be keen on my screening and to keep on reminding my relatives to do the same. Thank you.
Okay, thank you. Timothy, you can also speak on the hereditary part.
Yes, thank you. As I had earlier said, is that there's a strong family history of colon cancer, starting with my father and also my paternal grandmother. In the line of my father, we have about 6 aunties and cousins who have also had colon cancer and unfortunately have succumbed to it. So we have a very strong history, and that has led that all the members of my family are urged and asked to constantly go for screening so that it can be detected as early as possible.
Okay, Moses, what was your experience? Do you have family members with cancer or who have been diagnosed with cancer? Moses, are you still in the call? Okay, I think Moses has dropped off. So I think we are winding up, and I'll just ask each of the speakers to just give us their parting shot. What would you want to tell perhaps someone who's in this journey and someone who may not have any experience with cancer? What is your message to them? We can start with Eva.
Okay, I think the first first I would like to say that you don't have to go through this alone. It is very difficult. And I know there are people who, because of, you know, their personality or lifestyle, they may not want to be out there like some of us, but just find some close people around you to walk the journey with you. Find a support group near you because it makes it lighter. There are things that we can laugh about as survivors, which we cannot laugh about with non-survivors. So we find comfort, we find love, we find relatability when we commune with each other as survivors. And then two is have a very close relationship with your healthcare provider. I know most of them are a phone call away, a WhatsApp message away, an SMS away. You know, just keep have them close to you as you walk this journey. And finally, you know, just go for your screening. This goes to everybody because cancer can get anybody, even without a family history of cancer. That is, you know, cancer is that one of those things that we don't understand. We don't know where it comes from. So all we can do is do our best to have a healthy lifestyle, to do the screening, and whatever cancer, if there's anything that you're told that can help lower the risk, prevent that cancer, let's go for it. For those who have you know, younger daughters, there's a HPV vaccine which you know, helps prevent cervical cancer. Let's go for it. Let's try to do anything that is within our reach to lower the risk. And finally, let's always stay positive and look forward to a brighter new day. Thank you.
Thank you, Eva. Timothy, and your parting shot.
Thank you very much. And first, I'd like to appreciate the opportunity given to present in this webinar. As much as I'm presenting my case, I'm also learning a lot from my fellow panelists. My parting shot will be for everyone to have screening as early as possible. Screening, as we are always told, that early detections increases your chances of survival a lot. Secondly, is the issue of acceptance. that there is need to accept the diagnosis. Many times we find people who are given a diagnosis do not accept and also refuse treatment, which now their chances of survival lowers because of that. I would urge the issue of support to survivors. There is need for a lot of counseling to survivors to learn how to live with it. In my opinion, I would say there's a lot that is done and a lot of information out there about the issue of screening, the issue of treatment, but there needs to be more on the issue of survivorship. And I think this is a great step talking about survivorship. There is need for a lot of information out there and a lot of support for survivors as far as counseling is concerned, mental health, and also looking for ways for financing some of the things. Because one of the things that survivors go through is that they might need assisting devices after that they did not need before. And some of these assisting devices are quite expensive. So would like to see the government come in more to be able to help the survivors live a better quality life. So thank you for the opportunity, and I have really learned a lot being here. Thank you very much.
Thank you so much, Timothy. You're inspiring us, and keep up the good job. Moses, you're back.
Yes, can you hear me?
Oh, yes, we can hear you. You
Sorry,
said you wanted
I'm
to
in
contribute
town.
some. Yes.
Yes, I'm in town where I was nimepigwa tiaga, so I'm just looking for a different location. Yeah, but now I'm okay.
Also,
So yeah, just to contribute first on the issue on cancer in our family. I can say that when I was diagnosed first, I was the only one in the family with cancer history. So there was this uncle who came and he told us like, hizo ni mambo za uchawi, you know, those are witchcraft, we've never had cancer in our family, you know, our typical uncles from the village. So fast forward to last year, the first daughter, the uncle, was diagnosed with throat cancer, and we lost her last year. And as recent as also last week, the same uncle who was there talking about witchcraft and everything, we lost her. We lost him. Sorry. On Tuesday, he was diagnosed with prostate cancer. So at the time I was the first, but now looking at this history, my first cousin, now my uncle, it makes me even little more worried if it's in the family, if I pass it down to my kids and things like that. But yeah, so we lost my uncle last Tuesday, and we are going to bury him in next week on 21st due to prostate cancer. Yeah, and my parting shot is just to the family: be strong, be courageous, be there for your loved ones, show them support because you are the number one support system to the patient. If you don't show them support, they want to believe in themselves, they want to go through the treatment. So just show them support, believe in them, even if no one or the world is against them, be there for them. And with that support, they'll be able to get through this treatment, and just the government just make it easy to the patient. If it's just cutting the cost of treatment, if supporting them with assistive device, like for some of us after amputation, we are required to have like a wheelchair or crutches. Those are the extra money that maybe the family at the time didn't have. So if you can have government come in those sectors, just provide assistive devices and make it easier for family in terms of hospital bills, yeah, it will really help a lot. And to the patients now, believe in yourself, just talk about your story. And the more you talk about these things, is when they get off your chest, you'll be strong and get courage to walk and come out there strong. But the moment that you isolate yourself, you don't speak about these things, you won't get that courage, and you'll be isolated. Some end up committing suicide and such, which is a bad thing. So anytime you believe in yourself, Just talk to someone if you feel weak or you don't have any support. Talk to your friend, your family, the immediate family. They'll show you that support. Yeah. Thank you so much for the opportunity. I really learned a lot. It's been a while. I haven't been able to share my story. So thank you for this opportunity.
Thank you so much, Moses. Maybe just to ask you, is there any form of advocacy that you are now doing, maybe to the children who've been diagnosed with cancer or their families? Are you doing that?
Yes, I've always been vocal about my story and sharing the story of also other cancer patients. There's a group called the Fadil Leukemia Foundation that I've partnered with, which we usually visit Kenyatta National Hospital, the children's department, the children's wards, where we bring toys, we bring the essentials that they need, we talk to the kids, we encourage them, we dance with them, play with them, just to show them that it's not the end of life. I was there, I came out strong. Also, you'll come out of it. We also have another group called Save One Initiative, where we try to help and assist kids whose parents are going through treatment. So maybe you find a parent is going through treatment, they don't have ways to the uniform and such. So we mobilize funds, we pay for their fees, we pay for small things, we look for donors. And I've also been able to go to different TV stations to do advocacy. I've been on these panels, I've used our voices, I've spoken out. So yeah, just to advocate about these diseases. And yeah, thank you.
All right, thank you so much, Moses. So as I wind up, I think I'll just leave the following information. So for our health workers, in case you need any more information about cancer, about the documents that can guide you on what the ministry is doing and what is available in the country, kindly look on the website called nccp.go.ke. You'll find the different documents there. You'll even find the cancer screening guidelines so that you know what kind of screening to do to the different populations of our patients. And also just to inform you, we have over 10 regional cancer centers spread across the country that are actually offering cancer treatment. And Mombasa, Nakuru, and Garissa have radiotherapy services. I think most people didn't know that we have radiotherapy beyond the tertiary hospitals. So apart from KNH, KU, referral, and MTRH, we also have Nakuru, Garissa, and Mombasa, which have radiotherapy, and your patients can be seen in those centers. So for patient support groups, if you're a patient and you need a support group, kindly look up at KENCO, Kenya Network of Cancer Organizations. They are based in Upper Hill. Just look for them online. You will find their contacts and reach out to them. They will link you with a support group for the different types of cancers. They have many support groups under their umbrella. Also, we have the MOH Virtual Academy. So on this virtual academy, you find different training modules for different units. And one of the units offered there is early diagnosis of cancer for primary health workers. This is a free unit. You just register on the site and you even get CPD points and a certificate. So just to learn more on the different types of cancers, what are the risk factors, the signs and symptoms, which are the basic tests that you can do on your patients, because we realize these patients don't get diagnosed late with cancer. They're actually in the system, but they're being managed for different things. You see an old man is 70 years being treated for constipation. That is someone who needs to be assessed for prostate cancer. You see, so instead of staying with these patients in the system for a whole year, it's good to refer them for further checkup. So for this recording of this webinar, you'll find it on the KNH Research YouTube channel. It will be uploaded there. And so we will end at that. This is the Cancer Survivors Awareness Month. we are all united by unique. Cancer is very unique. Every patient is unique. Every journey is unique, but we are all united by unique. So thank you so much, all our patients. Thank you to our survivors and our thrivers. Thank you for the health workers team. You really support these patients. You really work with them through the journey, and we really appreciate the work that you do. So we'll end at that. And thank you very much. I was your moderator, Dr. Jeffrida Chepchumba. Thank you.
Thank you.
Thank you, everyone. Bye.
Goodbye. Have a good evening.